Everybody, it's your girl Hadley. I am back. It's been a long time. It's been months since I've given you guys an update on my hair journey and what has been going on lately. So before I start, I just want to say that these are trying times. These are very unprecedented times. This pandemic has affected us in unimaginable ways, and I hope that everybody is taking care of their mental health. Remember, mental health is power. Mental health is important, and I hope that you guys are pampering yourself or doing whatever it is that you need to do to achieve that mental stability and that tranquility and that peace. So without further ado, let's get started. Initially, I was aiming to do this video on a little bit of an update on my protein overload, or what I thought was protein overload. It turns out that I actually have something called Telogen Effluvium. Yeah, it's just a fancy word that doctors like to use for stress-induced hair loss. Way back in May, my grandmother had told me that it was due to stress, and I was like, no, there's no way. And every time that I got on the phone with her, she would say the same thing. And I was so in denial, like when you're in a toxic relationship and everybody else knows it except for you. Yeah, that's how in denial I was. And like, one thing is, like, I understand I'm in medical school and it's very stressful. Like, by no means am I saying it's not. But I've been dealing with stress since 2003. Okay, well then I was 5 years old, but you get what I mean. Like, I've been dealing with stress for the past 5 years on this path to become a doctor. Like, why now? Why is it manifesting now? Anyway, so Telogen Effluvium is basically stress-induced diffuse hair loss. By diffuse, we mean that hair kind of falls off from your entire head. There's no like extreme patches or extreme baldness anywhere, but you are losing your hair from all areas of your head. For me, after 4 months of like losing my hair in the shower, every time I showered, it was a new breakdown. It was a new big chunk of hair falling out of my head. Initially, I thought, okay, my hair was dry, my hair was brittle, it's protein overload. Yes, I'm losing a little bit of hair, what I thought was a little bit, and then it just became very, very severe. And I realized that it wasn't protein overload when after 4 months, I was losing hair in such large quantities, and my hair wasn't brittle anymore, which is what happens with protein overload. You get brittleness, you get dryness. My hair was moisturized, my hair was silky, it was beautiful, but I was losing it. This caused me so much stress. One of the things that they say when you have Telogen Effluvium is that you can get into this vicious cycle of like, you're losing your hair because you're stressed, and then you shower, you wash your hair, and then you see all this drastic amount of hair in the drain and all over the walls and everywhere, and then you get stressed again. So it's this vicious cycle of stress upon stress upon stress. So at some point, like, I had to accept it. So to explain Telogen Effluvium a little bit better, it's stress-induced diffuse hair loss due to some sort of shock to the system. And by that, we mean some sort of big stressor. So usually occurring like, I don't know, I think the range is like 3 months to a year prior to the hair loss. And one of the things the doctor explained as well is that when you have such a big stressor and when you have such a like shock to the system, the very first place in which it manifests is your hair. So Telogen Effluvium basically causes your hair to get stuck in the telogen phase. So there are multiple phases of hair development. I know there's like the anagen phase, and like the telogen phase is kind of like the resting phase. And what happens in Telogen Effluvium is that your hair kind of gets stuck in the telogen phase and just starts to fall out. So to give you a little bit of a reference, at any point in time, our hair overall, if you don't have Telogen Effluvium or any other like hair pathology, then less than 10% of your hair should be in the telogen phase. So you can imagine you would lose like very little every time you wash your hair. With Telogen Effluvium, however, about 50% of your hair is stuck in the telogen phase. 50%. So it's a very large amount, and you're constantly seeing that hair fall out, and your hair can actually be reduced by up to 50% or even higher. Like, I'm pretty confident that I've lost more than 50% of my hair, especially because like I said, it's diffuse hair loss, so other people don't necessarily notice it. Like, if you look at my hair, you won't necessarily notice that I'm losing hair. You won't necessarily be like, oh, she's balding, because you don't necessarily bald. There are no patches. It's very diffuse. But you do yourself, you feel the weightlessness of your hair. You feel it thinning out. You see that you've lost a lot of it. And I see it most when I'm in the shower and I have like a little bit of, like, my hair, when I grab it, it's like this small of a hole. Like, all my hair fits in this little hole. Or I notice it when I know that I don't want to curl my hair anymore. I don't want to leave it out curly because there's no volume to it, because there's no weight to it. But like I said, other people don't necessarily notice it, so that's the pro of having telogen effluvium, if we're looking at this in a positive light. So when I realized it was too severe and that I was losing all this hair when I showered, I decided to go to my doctor and explain to her what was going on. And she basically ran labs. She too told me that it was stress. As soon as they hear medical student, they're like, oh my God, it's stress. So she ran my labs. Everything was normal. There was no hypothyroidism, which does run in my family. There was no nutritional deficiency, no vitamin deficiency, no bacteria or fungus or anything out of the ordinary, really, that could have caused this hair loss. So I got a referral to go to the dermatologist. And I basically explained the whole situation to the derm. And I also told him that what could have preceded the hair loss was this protein rice water treatment that I had done exactly a week prior to the diffuse hair loss. I thought that it was due to that because it was just so dramatic. Like, I did the protein treatment twice in a row for a little too long, and then I started to lose it like very dramatically. After explaining that, he basically was like, yeah, you have stress-induced hair loss, you have telogen effluvium. And I was really like, there's no way the doctor is telling me the same thing that everybody else was telling me in these past 4 months, that it's stress. Like, I was so sure that it was just due to the rice water. And he was like, it's stress-induced hair loss. This is a typical thing that happens in your population, meaning young adults. The most common cause of hair loss is telogen effluvium. So another thing that he mentioned was that there is a correlation with COVID and hair loss. So I actually got COVID back in, when it started, March, when this whole thing started. And I didn't know, I didn't have any symptoms. All that happened was that I had a little bit of taste deficits. I didn't taste anything. I didn't really smell anything. And the only time I noticed it was when my boyfriend made some soup and it didn't taste like anything. And I was like, this is bland. And he was enjoying it. So I was like, there's something going on here. But it lasted like, 3 to 5 days, maybe a week. Back then, I don't think that was known. So I didn't really know what it was, and it went away. And I was like, okay. And then turns out that when I went to the doctor and she ran my labs for the hair loss, I actually had antibodies against COVID. So it correlated perfectly. One of the things that the doctor said was that he has been seeing an increase in hair loss patients since COVID started. And they don't know if they can attribute that to COVID itself or to just the stress of the pandemic overall. And there you have it. I have telogen effluvium, and I have come to peace with it. I've just accepted it at this point, and that's the first thing you have to do to heal from this, is really accept the fact that it's happening. The good thing about telogen effluvium is that it doesn't last forever, so that's comforting. Typically, they say that it should last between 6 months to a year, maybe even less, sometimes 3 months. I've had it for, May, June, July, August, September, October, November, December. I've had it for 7 months. There is no particular treatment for the telogen effluvium. Like, there's no particular treatment for getting your hairs out of the telogen phase and getting rid of that. Treatment for telogen effluvium, really, for me at least, focuses on regrowing my hair and regrowing my hair in a healthy way. So the good thing is the hair usually does grow back. So that's a pro, and it doesn't ever really progress to complete baldness. So right now, what my dermatologist recommended for me was to get cortisol shots, because cortisol shots to your head. Yeah, it sounds a little dramatic. It's like a little stabbing needle that they put cortisol all over your head, and it's not pleasant, but you know, it's working for me. So basically, it's a steroid that is used to treat another type of hair loss. I think it's like alopecia areata. It's usually used for that, but it can work for Telogen Effluvium to allow more hair to grow back, or like to allow rapid hair to grow back. So I've been using that, and I started, like I said, I started going to the dermatologist in October. So at this point, it's been about 4 months since I started the treatment, getting these shots every 2 weeks. So I have an appointment every 2 weeks in which they inject cortisol over my head. In conjunction with that, I started to take Minoxidil. So Minoxidil is basically another sort of drug that you apply to your head. It decreases the DHT in your system, and DHT also can lead to some sort of hair loss. It also decreases that, and also helps with really regrowing hair really fast. And if you don't know the name Minoxidil, then you most likely know the trade name, which is Rogaine. And so I've been using Rogaine for the past like 2 or 3 months, but I've had some serious complications with this. So I wanted to actually explain. So at first, I was just doing the cortisol shots, and then after doing much research, I realized that you can take cortisol with the Minoxidil or the Rogaine. There's different types of Rogaine. There's like 2%, there's 5%. I bought the 5%, and I wanted to use it, the strongest one, because I wanted my hair to grow back, blah, blah, blah. But turns out that it gave me facial edema, and facial edema is just basically facial swelling. So I had very severe swelling, and I was so scared. It was very scary. I called the doctor immediately, and I explained to him what was happening, and he basically said, "You're using too much, you're overdosing." And I gotta say, I was desperate. I wanted this to work. I wanted to put it all over my hair. I didn't really pay attention to the specifics of the instructions, which is never a good thing. You're dealing with drugs. Even though I'm not ingesting it, I am putting it in my head, which goes directly to your blood vessels, and then anyway, he recommended that I stopped using it for a little bit and then try again at the appropriate dosage. That's what I did, and it was working fine. Like, I was good. I wasn't having the edema. My hair was growing back. As you can see, even here, my hair is like really growing back a lot. And then about like 2 or 3 weeks ago, I noticed that I was having facial hair, and like, I've never had facial hair in my life. Like, I've never really had significant facial hair. And I'm like, what is going on? Like, what is this? And then I realized, I spoke to the doctor. Well, first I researched it, and I realized that one of the side effects for Rogaine could be, or for Minoxidil, could be facial hair. My doctor did not tell me this, that I could possibly have this, and why am I having all these rare side effects? I don't know. This is the Rogaine that I've been using. So basically, to resolve this, I had to think of ways that I wanted to get rid of this facial hair, because to me, like, it wasn't a lot necessarily, but I've never really had facial hair, like, at all. To have suddenly all this hair, I was just not comfortable with it. So I decided to wax my face, and that did not go well. I thought that maybe waxing would have helped it, and it wouldn't allow the hair to grow back out. But I think that was just a big mistake. Like, I should not have done that. I then was looking up different ways that, you know, women get rid of facial hair. And one of the ones I saw was like using these little facial hair razors. These facial hair razors are supposedly really good. They're like specially made to take off like women's facial hair. So they worked well. As you can see, like, it's been what? Maybe like, I think it's been about a week and a half, and my hair is not really there as it used to. It was a lot before. Like, I noticed it a lot. And hopefully it doesn't come back. But if it does, I have extras. The good thing though is that now I have eyebrows, because, oh, well, I have makeup on, but now I have eyebrows, because before I didn't really have a lot of hair in my brows, but because of this whole Minoxidil and facial hair grow, like, I have hair in my brows, so that's fun. Of course, in addition to the combination of Minoxidil or Rogaine with the cortisol shots, I was also using like vitamins and oils, especially rosemary oil. I was using that like, what, twice a week? Putting rosemary oil with olive oil and a little bit of coconut oil, mixing that and putting it all over my scalp. In addition to that, I was also taking biotin pills, which were these. Okay, so this brings us to where we are now. Now I'm still taking my biotin pills. I'm still going to the dermatologist to get my cortisol shots every 2 weeks. But I definitely stopped the Minoxidil / Rogaine, and even though it did a great job at bringing my hair back, I don't want that facial hair. I don't want those side effects. So I stopped it for good, and now I am losing hair still, but it's definitely less than the beginning. But I'm very displeased with the amount of hair that I currently have. I don't like how it feels very weightless. It feels lifeless. It feels so thin. I don't curl my hair anymore. I always have it up in a little bun all the time. So I'm not happy with it. And like I said, at this point, I must have lost more than 50% of my hair. And I think for my own mental health, to be able to get over this whole hurdle and this whole telogen effluvium, I think that I'm going to, are you ready? Big announcement. I am going to cut my hair into a pixie cut. I've never had a pixie cut in my life. I am really excited to see how I'm gonna look, to see how I'm gonna rock this look, to see what happens to my confidence, like my confidence. I've watched so many YouTube videos and women really feel empowered. They feel like fearless and just sexy. And I'm most of all excited to take you all into this journey with me. That was kind of my big announcement at the end of this video. You know, when do you really get to have a pixie cut? When do you really get to cut your hair short? Like, I want to say that I did it once in my life. So, and it's kind of like a new beginning to me, to my life, and a new journey to restore the volume, the beautifulness, the amount of hair that I had. I'm definitely going to be trying a whole lot of different vitamins, different hair growth oils, and just different hair growth routines and different things like that. So if you guys want to see that, please stay tuned. On my next video, you guys are going to be shocked to see me with my pixie cut, but I'm very excited for you guys to see me, and I hope you guys think I look cute, but you know, I'm still gonna be feeling myself. Thank you guys for watching. This is all I have for today. If you like this video, make sure to give it a thumbs up. Make sure to subscribe and also hit up the bell button to get more notifications on my upcoming videos. Thank you guys for watching. Bye.